This is Dr. Anderson with North Texas Plastic Surgery, and for this video, I'm going to be talking about just lots of fun stuff. We're going to talk about add-ons that you can do with your mommy makeover surgery. When I think about these add-ons, in my head, I've kind of broken them down into face things, body things, and then med spa things. So we'll start off with face. I think the most common add-on that people will ask me about is an upper bleph. So if you talk to me about this, I will half jokingly, kind of not really jokingly at all, say anybody above about the age of 35 can probably benefit from an upper bleph. Now, again, that's me being a little sarcastic, but you know, if we look very carefully at ourselves, signs of aging of the upper lids can be one of the first things that people will really notice in their face. That is, quite frankly, a super easy treatment to add on in your surgery. For those of you that don't know, upper bleph or upper eyelid lift is taking a little bit of skin, sometimes some fat as well, from that upper lid. And what that does is it helps open the eye and kind of rejuvenate the upper eye area. A lot of times women will come in and they will tell me things like, you know, when I put on my eye makeup, if I'm doing eye makeup, I really have to raise my brow so I can actually get in there. Or after it's been on for a little while, they'll get a couple creases that become noticeable and they're not liking. So that surgery itself takes maybe 45 minutes. There's very limited issues afterwards. The most common thing that people are going to complain about is bruising. And realistically, they're not going to complain about that because they know it's possible anyways, and that goes away in a couple of weeks. If I am doing that for you, I will leave a line of sutures that you can see. Those come out at 1 week. Then we have to talk about what to expect after that. So I always tell folks that skin is very thin, so it takes swelling a while to go away. We really can't judge our results for like 3 months. And again, that's the pretty much easiest face add-on that people will ask me about. Now, I jokingly told you that that was patients 35 and above. Certainly my ladies that are 40 and older, I don't want to say benefit more, but they're probably going to notice it more. And that's a common thing for them to ask about and to add on in a way that is very safe and doesn't add much time. Now, we can also potentially talk about the lower lids. I'm going to be ever so slightly more hesitant to do that, although you might talk me into it. The reason there's a little more hesitation is that surgery is a little more delicate and involved than the uppers, and the swelling that's associated with it can be a little bit more prohibitive. Now, the people that I'm certainly gonna say we really need to think about that being its own surgery are those that are getting a fat transfer to their butt. And you may think, what's the correlation? That doesn't make any sense at all. But the reason for that is if you're getting a fat transfer to the booty, we're gonna finish surgery with your face down. And so I'm gonna have to do that lower lid surgery, and then you're gonna be face down for however long it takes to do the back half of your procedure. And the amount of swelling that will come in and potential issues with that swelling long-term are higher. So in that case, it's probably not worth it. But ask me, we'll talk about it. If it's a good thing, we'll do it. If it's not a good thing, maybe we can do it down the road if it's something that bothers you enough. Another thing that people, this one's less common that have asked about, is as we age, the length of our upper lip here will elongate. That's gonna be the minority of patients who that bothers, but that surgery is something that I can do very efficiently and expediently in the OR. So if it's something that bothers you enough that you want done during the mommy makeover, we can certainly talk about that one as well. Things that I will not do, because you'll ask and then we just need to know. Rhinoplasty, not gonna happen. Facelift, not gonna happen. Reasons for those is some of it gets a little bit me on my soapbox, some of it's time related. Those surgeries take longer, and the amount of time that they would add to the mommy makeover is gonna put you under anesthesia, what I would think of as a prohibitively long time, so we're just not gonna do them. In addition, Because of the anatomy and the finer points of those surgeries, I think they warrant being done on their own so that you can have me in kind of rhinoplasty facelift mindset versus breast body mindset. A couple other things that we're just not gonna do are Botox and filler. I've had people push back on these a little bit in the past. The reason that I am not gonna have those done at the time of surgery is, from my perspective, as a person who loves to personally get Botox and filler, you really need to interact with your injector when these things are going on. So trying to do them while you're asleep and can't participate is going to decrease safety, and quite frankly, it's gonna make the results not as good as when you're awake. In addition, and I can say this because I get these things all the time, the pain associated with them is so low that think that you're saving yourself from pain while you're asleep it just doesn't exist. So toughen up and you'll be fine. I shouldn't say stuff like that. Okay, so we're gonna move on to body add-ons that we can do. When people think of a mommy makeover, generally speaking, and this is of course different, we're gonna talk broad strokes, so don't get offended if you're not included in this group that I'm talking about, is some sort of breast surgery that includes a lift or reduction and lipo and a tummy tuck. If we're talking add-ons, things that people may want, and in my head I kind of think top to bottom, one of the more common ones when it comes to breast, if we're doing a breast lift, is a fat transfer to the breast. So let's back up a little bit. When we're in our consult and we're talking about a breast lift without an implant, I'm always going to tell you that by definition, I have to remove some skin and fat associated with that boob to get it to the place on your chest where we want it. If you're coming in and you're like, I really like the size that they are now and I don't really want to lose that, but I don't really want to go up in size with an implant, fat transfer may be a good option and is a good add-on for you. Moving down to the torso, one of the, if not the most common thing that we'll add on is skin tightening somewhere along the way, in addition to our skin removal that's happening with the tummy tuck. A lot of times when we'll come in and they will say, the upper part of my back here feels like the skin is a little bit loose, or they can see this little crease where their lowest rib is. So adding BodyTite or Quantum to the back to help kind of shrink wrap that skin back around your torso is by far the absolute most common add-on that I do in folks. Now, sometimes we'll do the flank as well if we're having some excess laxity there. Generally don't need to talk about it to the abdomen because I'm removing skin there. So tightening up that skin isn't necessary because that's what the tummy tuck is accomplishing. A couple of other things that people will frequently ask me about that ends up honestly just being part of that mommy makeover that's not an add-on, at least in the way I see things, is the mons area. Most women that are coming to see me that are asking for a tummy tuck kind of feel like that area has fallen forward and down. So when I'm doing your tummy tuck and removing skin, that area by definition will kind of come up and smooth out with the rest of the tummy skin. A lot of women in addition will talk about if they have a C-section scar, that they'll get this shelf there and they'll get this pooch above that kind of, I hate to use the word hangs, but hangs over front. Again, tummy tuck's gonna take care of all that, so we don't necessarily need to talk about that as its own separate entity. The other thing that people ask me about all the time is this little pinch here. We will discuss specifically during your consultation if that's something that can be treated. Meaning sometimes it's just skin, even though it feels like fat. Sometimes there's actually fat there. If there's fat, I'll just carry my liposuction up there. It doesn't take but a few minutes to get that. And it's, in my head, kind of just part of your lipo 360. Every once in a blue moon, if it's loose enough and we're doing BodyTite, I'll add some BodyTite there to kind of shrink it up. What I have learned is even you take somebody that's never had children, never been a pound overweight in their life, if they put on a tight sports bra, they're gonna have that pinch there. And if you pinch that, try to raise your arm over your head, you're gonna learn very quickly why you need that, because you won't be able to raise your arm over your head. Other common areas that people will ask me about are arms and especially inner thighs. I won't agree to this in every single procedure, but we should at least talk about it if it's a concern of yours. So another relatively common add-on is lipo with skin tightening to the arm. So it's not uncommon for a woman to complain, especially the back part of her arm, feeling like no matter what she does in the gym, no matter what she does with diet, that part is just stubborn and doesn't want to cooperate. If we're in a circumstance where you are an ideal candidate and will benefit from liposuction with skin tightening in the form of BodyTite or Quantum, that is a potential area. Now, if you're asking me to do a million other things, I'm gonna tell you that time under anesthesia is getting to be to a level where we need to really consider a second stage operation. That's possible. But if we're within the confines of safety, that is another relatively common area for me to do. In addition to that, inner thigh. Now, I don't see a lot of women who come to me and they're like, oh my God, I love my thighs. That's just, I think, the minority of women out there, and I'm not talking shade. It's just I talk to a lot of ladies and they tell me this. So I will tell you, with the tummy tuck that we're doing, because we're really focused on Mommy Makeover in this video, even though we're really pulling down skin, if you think about it, because we're pulling down so hard, we're gonna get some pull up from below. So there's going to be a degree of improvement of the inner thigh just by virtue of that. And honestly, the majority of women that I talk to that mention that in clinic before surgery never bring it up again after, but we talk about it. So if the inner thigh, if you have that little fat bulge, especially at the very top of the thigh, and that's something as well that will respond well to liposuction and skin tightening at the same time, and again, we're within the confines of safety, that is another common add-on that people will do. I think that kind of takes care of most of the body things, add-ons that people want. Other than, I talked about fat transfer to the breast, fat transfer to the booty as well. I don't necessarily think of that so much as an add-on because usually that's a complaint that's kind of primary procedure. But again, that's a theoretical add-on as well. Most people these days aren't looking for like 2004 rap video huge butts. They really just kind of want some rounding and shaping, so that way if they're wearing their athleisure clothes, going to whatever yoga F45 class, that they just kind of like looks round and nice and not like in your face and crazy. The third aspect of surgical add-ons is, I don't want to say most common because we talked about BodyTite, that's definitely the most common, but like also very, very frequent is med spa things that then we can do in the OR, so you're saving yourself a little trouble in the med spa. The most common of those is Morpheus 8. So for those of you that don't know, Morpheus 8 is radiofrequency microneedling. And what that is almost like BodyTite, but from above instead of below the skin. So it's some needles that penetrate the skin and they deliver radiofrequency energy, which helps us with skin tightening. This is another procedure that I love, just like we were talking about Botox and filler. I'm up to 3 times a year for Morpheus on my face. It's because I'm trying to like lock myself in time, like Benjamin Button type situation. But it kind of hurts. If you do it in the med spa, you'll get numbing to optimize how much it doesn't hurt. But it's like if we're in the OR already, you're already asleep, and we can do it safely within our time constraints, getting it done there, especially face and neck, is the most common med spa add-on that I see. That being said, Morpheus 8 works well for other things in other places. People frequently will ask me about good treatments for cellulite. Personally, I don't believe that there's any like really killer treatments that are just gonna knock your cellulite totally out and make yourself eggshell smooth. But in my experience, Morpheus 8 is one of the better treatments out there to optimize those results. So whether that's back of arms, back of legs, but those are all areas that can be treated with Morpheus in the OR as an add-on. Now, it should be noted that if you're going to ask me about those things, it's important to note that that is not a one-time treatment, that to get those results and to maintain them, that's something that you should be doing yearly or potentially a tiny bit more than that as time goes on so that you can keep those results. Other common things from the med spa that we do in the OR is especially CO2 laser. So that's most of the time going to be face and neck for skin resurfacing. That can help with pore size, sometimes some pigment, fine lines and wrinkles, overall skin texture. That's gonna be a little bit more downtime than a procedure like Morpheus, but you're already having downtime from your Mommy Makeover procedure. So some folks that feel like they'd benefit from that, they're like, hey, I can knock out the face recovery at the same time as the body recovery. Those end up being the most common things from the med spa after surgery. So we've kind of gone through face surgical, body surgical, face med spa, a little bit of body med spa in there. If you're interested in these things, just ask me at time of consult and we can go over it with whatever level of detail you need. This has been Dr. Anderson with North Texas Plastic Surgery. If you liked this content, make sure to like, comment, and subscribe below, and we'll keep making more of it. All right. Don't say all right. If you put all right in there, kick your ass.
Started in the middle of that.
Definitely not.